Salve had another commitment, so he's not able to be with us, but he's with the Office of Marketing and Communications in Penn State Health in Hershey. So he gave me a few slides, and well, since he was here, I kind of condensed them down a little bit to try to save some time. But I do want to talk a bit about what he's involved with as well. Anyway, so what now? There we go.
Okay.
Okay, so just a brief outline. So what I'm going to do is review the problem, and then then Betsy's going to talk about her study where she examined increasing participation to clinical trials, particularly cancer clinical trials in central Pennsylvania. Penny's going to talk about a number of successful strategies from her experience as well as from the literature. And then I'll give a few slides on marketing and communications from Matt. And then I'll come back and talk about the Penn State and the Trial Innovation Network. And then hopefully we'll have 10 or 15 minutes at the end to talk about our presentation. So the problem is not new, and it's not unique to Penn State in any way, shape, or form. And you'll see a variety of numbers. So let's not get too hung up on whether it's 80 or 75 or 70%. And you'll see as I talk, most of my experience is related to cancer, so that is what you'll see. Penny's obviously is related to nutrition, so you'll see that from her. But anyway, about 80% of clinical trials in the US fail to meet patient recruitment objectives or their timeline. And that's really appalling. And of course that leads to scientific questions that originally were posed being unanswered. Or if you've got a poor representation, you're not able to generalize results to other populations. And I think an important consideration is that really we potentially risk breaking the human subject protection promise that we've made. Because if we really have designed and are starting a study that really has little chance of reaching the power that it was designed to do, that's a problem. You might actually be causing failure or potential failure to find a beneficial impact that you proposed you were going to do. And maybe there's actually harm that's causing. So there's an important human subject protection issue here. It also leads to could lead to public skepticism and failure to trust research, which is not a good place for any of us to be. And of course, it's going to increase costs. But it's not only just that recruitment is low, but it's disproportionate. So these are some numbers that I found mostly from the cancer literature, but about 5% of enrollees are African American, and that's compared to 12% of the US population. 1% are Hispanic or Latino compared to about 16% of the population. In some of the phase 2 and phase 3 cancer studies, we see problems with enrolling older individuals. So 32% of participants in those studies are 65 plus, yet that represents 61% of cancer cases. And then particular to Penn State, we want to think about the rural areas. So accrual to cancer studies from rural zip codes not adjacent to an MSA. So these are ones that are fairly far away. Was about 90% of what it is those living in rural and suburban zip codes. And you would think that that may be, and I'm sure it's partly related to just the availability of hospitals and the trials, but if you look at this map, which is a bit old, it's from 2002, but it's one of the few that I've seen where it's really looking at some of the geographic distribution. You can see the highest recruitment, again, these are two cancer studies, is actually in the north central part of the US, up in North Dakota, Minnesota, Iowa. They're quite rural. So it's not just a function of being rural. And then also when you look in the southern portion of the US, many of those states are quite rural as well, and they have what might be expected as being very low recruitment rates as well. So it is a geographic issue as well. So anyway, I hope that set the stage. And what I'm going to do now is turn it over to Betsy to talk about a study that she led and completed a few years ago. and particularly focused upon the central Pennsylvania area. So we're waiting for Betsy and Sarah to take this over here.
Yeah, we are just getting loaded.
Great.
All right.
All right. Well, good afternoon, everybody. I'm Betsy, and I'm going to come at this particular issue from an educational perspective and tell a story of a study that Gene and I conducted several years ago that has us working more with the community versus the clinical setting. So I'm going to start with the shortest Jeopardy program ever, and I'm going to ask you all, here's the answer, guinea pig. What's the question? You in this room can answer if you want to. What do you think? What is a guinea pig? Okay, what people think they are. Okay, very, very good. So the question is, what do our communities know about clinical trials? And you're absolutely right. What I've learned in this process is that there are many myths and misconceptions around clinical trials participation when we get into the community. It's not only about their view that they're seen as guinea pigs for scientists, but what other myths do people have in conjunction with clinical trials in their mind? What do you think?
If they agree to genetic testing, they're going to, you know, their information go out to their
There's confidentiality issues. Exactly. Thank you. There's a misconception that clinical trials are only for the sickest patients. There's about what the standard of care means, what the role of placebos are, what does randomization mean. And so I think from an educational perspective, there's much that we can learn and conduct research in that area. So I'm going to be telling a story today about our published research, and this was also a winner of the first prize investigator category at the recent Cancer Disparities meeting. But as I said before, I come at this from a very different perspective. When we look at this diagram, and eventually. If you look at this diagram, you can see where most conversations about clinical trials education takes place. So from this diagram, where does this occur? It happens where? It happens with the provider at the time of diagnosis. And so we started to think about, well, how favorable are those conditions for people to think about their participation? There's a lot of anxiety, there's a lot of fear. And at the time that I was doing this study, I was also going through cancer diagnoses with my father and father-in-law, and in this particular venue, where they were really not all that excited about hearing about clinical trials after they got their cancer diagnosis. So we started to think about how we can take this out to the further borders of this diagram, addressing this in the community and in society in general. So, as I said before, I come from an educational perspective, and we started to think, what would it be like if we could educate the community about clinical trials before they even have any dealings with their clinical provider about their cancer diagnosis? So I started looking for existing educational modules that address this. And lo and behold, NCI did have a module called the Clinical Trial Education Series that had not really been tested. Only a few studies had looked at its efficacy and effectiveness. And I thought, this is the perfect time to take this to the community. So lo and behold, what we learned about this curriculum is it was 6 to 8 hours in length. And I started thinking, well, people have about as much interest in participating in a 6 to 8 hour class as they do in getting a colonoscopy. All right, so not a whole lot of interest there. So my job in this study was to adapt this curriculum to be a 1 hour program. And that seemed to be evidence-based, based upon current cancer education programming that we had been involved in, that seemed to be a suitable amount of time. So what we did was I adapted the long 6 to 8 hour program into 1 hour, and we wanted to look at where best to implement this study. So we decided that we were going to conduct and implement the study or the educational program in 2 different venues, work sites and faith-based venues. So why would we think about choosing faith-based venues for this particular topic? Any ideas? Well, what the literature tells us is that many times people turn to their faith-based roots when there's a cancer diagnosis and for advisement about treatment paths. So it seemed as though there was a strong connection there. So we wanted to look at both faith-based environments and more typical environments for folks. So we did this in 8 different settings, 4 worksite and 4 faith-based, both in rural and urban communities. That was phase 1, doing the educational program. The second part of this was after the hour, we did a series of focus groups with every group to say, what did you like about the educational experience? What would you recommend that was different? How might we go about further customizing this to folks in your community, at your church, to make it more effective? And so what I have here on the screen are some of the main outcomes of this intervention. And I would say, I come at this, it's going forward when it shouldn't. I come at this more from a teaching perspective, and I have to say that, can I back up here?
D has to back up.
There we go, thank you. I would have to say from a teaching perspective, I'd never seen this type of transformation in an audience before. As we said before, people have very strong feelings about clinical trials, and they're not always positive. So what we learned from the pre and post test, that in an hour's time, looking at the basics about clinical trials, addressing myths, and some of the more common questions that people had, that we had some significant changes in their knowledge regarding clinical trials, in their intention to recommend clinical trials to a loved one, in their intention to actually participate in a clinical trial. So going from, I don't want to be a guinea pig, to tell me how I can search for clinical trials. And lastly, significance in decreased anxiety associated with potential participation. To me, that was very significant, that amount of time could bring about this transformation in people's attitudes. We got some great insights as well from the focus groups as far as integrating more personal community examples from their fellow community members about participation, giving them more practical skills about searching for clinical trials. Most people had in their mind that only clinical trials existed for treatment. They didn't know about prevention trials or diagnostic trials. So that really opened this up. And really from a faith-based perspective, they really embraced the idea that this is something that they would want to take on and share with their congregants about the benefits of this. So there was suggestions about involving the clergy. There were suggestions about integrating biblical passages, things like body as a temple and study to show thyself improved and my people die for a lack of knowledge. These types of things came up frequently in those focus groups. So I would say that we had some critical lessons that we learned, that the distance between myth, fact, and participation is much shorter than we thought when we start the recruitment process in the community. That's where it needs to be versus embedded in this clinical venue where folks have a lot of anxiety and fear already. And education is a pivotal part of recruitment, and it's currently neglected in favor of a post-diagnostic approach. And we further learned that education is effective, but it also needs to be customized to reflect the needs of the community members so they can embrace it and feel a level of comfort around learning about such highly emotionally charged issues like we associate with clinical trials. Okay. Thank you.
Great, thanks, Betsy. So now I'm going to turn it over to Penny Kris-Etherton, and she's here with me. So she's going to tell us about effective recruitment strategies in clinical nutrition studies.
Okay, great. So thank you very much. So from Jean, you heard how important effective recruitment strategies are for the success of a clinical trial. And from Betsy, you heard about an approach that worked for her. So today, I'm going to talk about evidence-based effective recruitment strategies from the literature, and then also share with you personal experiences that we've had over the years from starting in about 1987 to 88 when we did our first clinical study here at Penn State. So there's 3 different reviews in the literature that I'm going to talk about. 2 are Cochrane analysis. The first one, listed by Trewick, was published in 2010, and it was done on 45 clinical trials with 41,000 patients and participants. And then the second one, by the same first author, was published in 2013, and it was done also on 45 clinical trials, but with 43,000 participants. And the third one that's listed is just a description of a study that's in progress. So we have some information, but it's kind of interesting to read the paper by Gardner, because what they say is that, we really don't have as much information as we need on effective recruitment strategies. We have some, but boy, we really need a lot more. And then I'm going to talk about an interesting study that used electronic medical records to recruit participants in a clinical trial, and it compared electronic medical records with other strategies. I have a colleague at Penn State who used Facebook to recruit subjects for 2 clinical studies that she did. So I'll talk a little bit about that, and then I'm going to share with you our personal experiences. So for the first Trewick paper published in 2010, basically the conclusion is that trialists can increase recruitment strategies by using telephone reminders, and that is after individuals got perhaps a letter of invitation for a clinical trial, those telephone reminders really help. The use of opt-out procedures, and so that, of course, we know that according to the IRB, participants at any point, any stage in a clinical trial can decide to discontinue their participation. But basically, this review found that if there are certain things in the trial that they have the option to say yes or no to, that really does help. So for example, if at the end of a trial, you're asking the participant to give you permission to bank their their biological samples. They really like it if they have the opportunity to say yes or no to that, and whether or not you can share their samples or information with other investigators. They really like being asked about that, and that really does help in terms of encouraging them to say yes to participating in the study. And then in terms of procedures for contacting potential trial participants, basically this analysis showed that videos were very effective, but the subsequent one basically showed that videos weren't that effective, and I'll get into that in just a minute. And then open designs seem to be more effective rather than blinded designs. But we have to keep in mind that with open designs, then you're getting rid of blinding, and that could compromise certain studies. And then with certain opt-out procedures, if participants say, oh, I can't do this or I can't do that, and if those procedures are integral to data endpoints of your study, then that could be a real big problem. So that in the second Trewick meta-analysis, you can see some of the data here. And basically, with recruitment with audiovisual information, i.e. videos, well, it doesn't seem to be very effective. That's at the panel at the top. And then with clinical trials booklets and just standard trial information, I liken this to, nutrition ed information where we hand our patients a sheet of paper telling them, what current guidelines are for good nutrition practices. That doesn't seem to work real well either. And then recruitment with an invitation, including a study questionnaire and a study invitation. Very mixed results. In fact, one study did show some benefits, but when the collective results are summarized, really not much benefit there. But one thing that seemed to work was a recruitment telephone reminder, and that is somehow individuals are invited to participate in a study, and then these telephone reminders and follow-up seem to be effective. But again, you can see there are only 2 studies here, and so a lot more information is needed. And that's leading to this study by Gardner, who basically published the methods of a study that's ongoing. And, basically we need to know what effective recruitment strategies are. And there is pretty limited information out there. So the results of this study are forthcoming. And you can see it's believed that the results of this review will add to the current evidence base to inform clinical trialists of the most effective methods to recruit participants. So those are the 3 big reviews that are out there published since 2010. I included this study. I thought it was really a good one, and it's from the LIFT diabetes study. And these investigators compared recruiting with electronic medical records versus some other standardized approaches for recruitment. And you can see here that the electronic medical record proved to be a very effective method. And I have a figure here to show you compared with other sort of old school, standardized recruitment methods that we typically use. Now, the electronic medical records, I think, are really good for certain patient populations. So, for example, for people with diabetes, many of them have e-health tools to monitor their blood glucose and to, assure that their diabetes is in good control. So that, sending these patients notices about studies would be something that could be cost effective and actually yield good results, as you'll see here. So in this study, they looked at electronic medical records, referrals, the media, community screening, and then other strategies. And what you can see here is the percent yields of these different methods, but then also the number of participants they got with these different methods. So looking at, the top panel here, far left bar, you can see that with electronic medical records, the percent yield was between 20 and 25%. Not as good as referrals or, other strategies, but then look at the numbers. So that even though the yield is only 20-some%, they got 160 participants using electronic medical records. Compared with referrals, they got 66 patients, and other unknown methods, they got 16 participants. So you can see just the value of electronic medical records, how efficient they are in terms of getting a lot of participants. And then at the bottom panel, what you see here is what works best in different ethnic groups. So the electronic medical records work best in whites and other ethnic groups compared with African Americans. But still, it did work pretty well in African Americans. 62 participants were recruited that were African American with electronic medical records. So I think that this is sort of a new way for us to think about recruitment for future clinical study. And then Barbalossi did, a really interesting study looking at using Facebook to recruit low-income women to an online nutrition education program. And so she had an ad that appeared on a Facebook page, and this was for low-income women, 18 to 45 years of age, living in Pennsylvania. And I'll show you how she did this, but basically she posted an ad on Facebook and then, used that to actually get the data that she needed. And she found it to be, pretty effective, as you'll see. So she placed a 50-character recruitment ad called an impression on Facebook. And then you also submit keywords. So she submitted the keywords debt, unemployment. I might put nutrition or food or low-cost food. And then she had a recruitment survey. And then participants were not eligible, and so that they've just received some basic nutrition education. Or those who were eligible signed an informed consent form, and then they took the survey, and they received a little payment, and then they also received some additional information relative to what the program was all about. And so she did 2 different studies. One was family eating, and the other one was with, the benefits of folic acid. And let's see, in the family living study, they had 125,000 subjects, and the total cost of recruitment was $1,197. And so in the folic acid study, she had over 200,000 hits. Unbelievable. And, the cost was $1,321. So this is a very effective recruitment strategy, I think, for certain studies. Okay, so now I just want to turn our attention to some of my personal experiences with recruitment over the years. And, we all know that we have to get IRB approval for our studies, and along those lines, for all of our advertisements, they have to be approved by the IRB. And the IRB pays particular attention to the wording of our ads. They want to make sure that there's no hint of coercion, and they want to make sure that our study is pretty much in line with others that are being offered at Penn State. So we can't have one study where we offer participants $10,000 for their participation, and then another kind of similar study where we offer them $200 for their participation. So they really are a good watchdog to make sure that we're recruiting appropriately. We use flyers a lot, and we post them all around campus and all around town. We find key places that have a lot of traffic. So we go to supermarkets, we go to laundromats, sometimes we go to doctor's offices, and they let us post our flyers or display them on their coffee tables in their waiting rooms. And then we use mailboxes on campus. And so, oftentimes graduate students will go and distribute flyers and stuff mailboxes in offices. But it seems to work really well when we work with the secretarial staff in certain departments on campus and say, could you please distribute these in your faculty, staff, and student mailboxes? And then we use listserv emails, and there are a lot of different ones that we have access to. We use newspaper ads and bulletin ads. Newspaper ads can be important, or they can be expensive. They have yielded a lot of activity for us if they're placed in certain places in the paper. They can't be placed way in the back where nobody reads certain parts of the paper, and at certain times when there's more readership. And then Valpak ads. So these work really, really well for us. And so I'll show you some examples of ads that we place in these mailings. Basically, there are coupons that are for all sorts of different services and places that are sent to residents of houses, residents of homes in the State College area. And so we're one of many coupons that advertises our study. And then we'll go over to the union, and there's often a table that we can have access to, and we'll have graduate students be at the table and describe our study and try to get interest in it. And then we can actually place tents on some of the dining tables too to advertise our study. We use Craigslist. That seems to help, and Facebook too. So I'm happy to answer any questions after we get done.
Great. Thanks, Penny. Oops,
Oh,
here's your
that's our
examples.
ad. Yeah, they're my examples of our recruitment ads. And so let's see. The sheet on top is our ValPAC ad. In the past, we've advertised one study on one side, another study on the other side. We do it very differently. But then you can see examples of our ads, some of the posters that we post all around campus.
Well, I don't know about anybody else, but I go through the ValPAC envelope when I get it, and I pull out those $3 off at this restaurant and put it aside. You do too?
Oh, absolutely.
Okay. We all do. Okay, good. Just a couple of words. Matt couldn't be with us today. He had a prior engagement, but I did want to just to give you an update on some of the things that marketing communications at Penn State Health are involved with, because I guess it's important. I guess I'll say this now, but I think it's important to realize some of the findings from what Betsy talked about, how this community setting was very eager to know about it, to know about studies. There's a significant improvement in the knowledge and attitude and intent to participate, and they wanted to know about local examples. And that was very much in a community setting at the faith-based sites or at the work sites. Yet the data that you show say that that community siting screenings is not quite as effective. And I think both of those are true. But I think that what we have to do is to think about this as part of the overall strategy of educating the community. We'll talk a little bit later about how Betsy had proposed an application, R21 application to NCI to actually measure the impact on a chemo prevention study using 2 different recruitment strategies based upon what she did. So in those kind of studies, where it's a chemo prevention, where you're using basically recruiting healthy volunteers, I think that community type setting is really important and useful. So anyway, so I just want to kind of point that out here. But when you look at what the marketing and communications is doing, they're really laying some of the foundation. They are engaged in a general awareness messaging that reinforces that Penn State Health is a clinical trial destination, promoting the fact that we're really the only, Hershey's only the academic health system in central Pennsylvania, and that sets us apart from other institutions. They're trying to drive these readers and images to people to look at Study Finder, which is on the Penn State Health website, and then also in particular areas of, they have set of priorities that they're looking at, and one of those is cancer. So there are 3 initiatives that Matt mentioned that he asked me to bring up here. One is they're doing search engine marketing. So when you look at Google, it might come up, or Yahoo, or wherever you're looking at. We're trying to reach patients actively searching for research study, again, to drive them to Study Finder, and that's an ongoing process that they have for this next year. They're also doing ads on display for display or mobile or table or tablet. It should be tablet ads. So that's going out every other month, again, to a different sort of audience, again, using the internet. And then one unique thing they're trying to do here, I think it's coming up in April, they're doing a live show on research in the community on ABC 27. This is going to be a call-in show. And they're actually looking for researchers to field calls from the public at that time. So these are some of the things that Penn State Health and the Marketing Communications Group is doing. They have ongoing services as well, flyer and poster design, contributing to looking at effective language that's patient-friendly, newspaper ad, design and placement. So again, these are some of the services that Hershey provides to investigators there. Radio scripts, you can be put on the on-hold system, so when you make a phone call, you can get told about clinical trials. And then they also have a Facebook site and Twitter account, so they're posting there as well. I'm not sure how it works here at University Park, but all paid advertising must be placed through the Office of Marketing and Communications for research purposes. So that's from Matt. And then the last section here is about the Trial Innovation Network in Penn State. So we're going to try to bring this back home here. But before we get there, we got to talk about the bigger picture, right? So NCATS has started this Trial Innovation Network, or TIN. This was started really after we wrote our application, so we're still trying to adapt to what it is. But its purpose is to accelerate the translation of novel interventions into life-saving therapies. It was just started in the fall of 2016. But the areas that they are trying to address include training. So of course that's important for our training program here. Engaging patients and communities in every phase of the translational process. So they see that as part of their mission. To promote the integration of special and underserved populations into translational research across the human lifespan. Again, that is an attempt to really address some of those disparities that I outlined at the beginning. To develop innovative methods and processes to increase the quality and efficiency of translational research. And then, as Penny mentioned, to use cutting-edge informatics to help in that recruitment effort. So that's sort of what's going on at the NCATS level. So what they have done they've started 3 components. One is they have funded trial innovation centers, or what are called TICs, and they are located at Duke, Vanderbilt, Utah, and Johns Hopkins. They have also funded a Recruitment Innovation Center, or a RIC, which is located at Vanderbilt. And so those 2 are sort of the national entities that are there to help investigators at the hubs, and we are one of those hubs. So we have been asked to initiate this with a liaison team. But anyway, this is supposed to be the front line of the Trial Innovation Network, to lead the Trial Innovation Network again at the local level and connect the CTFA hubs to the TICs and the RIC. I'll talk a little bit about what we've done so far, just in the past couple of months, but this is a picture of a map of where all of the hubs are located. These are all the CTFA funded sites. So you can see there's 60-ish of them somewhere. Yeah, we're on there as well. So at the Penn State Network Hub, so we have initiated the process of a liaison team. We submitted the initial names, the names for the initial team to the to NCATS, and we responded to a brief survey about who these people are and how to communicate with them. It was very brief, but there's a promise of more to come. So some of the things that I'm expecting to see eventually are sort of some recommendations on best practices. I think that is probably a role of what this RIC effort is going to do. And then I would expect we're going to see something around metrics as well. It may be metrics for recruitment, may be a little bit lower priority than some of the clinical trials measurement, but I expect that we're going to end up seeing that. And then at Penn State, there's a trial component, and I'm not going to say anything about that. I'm just going to look at Neil Thomas, and he says he's going to give a presentation next month, right, on this topic. So you'll leap into that at that point in time. But on the recruitment component, so the way I see this is sort of 3 areas. One is our role is to facilitate recruitment to these national multi-site studies that the TIN is supposed to do. So when they approve a study, then there may be the potential for it to get implemented at Penn State and through Neil's shop. And then if that happens, then we would be obviously expected to recruit to that. So I think this hub effort should probably facilitate some sort of effort in that. And then it shouldn't be limited to just those network studies, but also to assist recruitment to Penn State studies. So some of the resources that Betsy presented, that Penny presented, some of the experience, I think that is part of our effort to try to get that out as well. And then the third I would also mention is that do we have the potential to facilitate studies of recruitment at Penn State? I'll mention a little bit more about that, but really to study the process of recruitment here at Penn State in central Pennsylvania. So here are 5 things that I think this hub could do. One is just engaging people and organizations. And I think that's part of what we're doing here today. Obviously, the investigators play an important role, but I'm really delighted to see a lot of, I think, project managers. I know some of them are there. But when we were going around thinking about writing this application, I asked a few investigators, what would you do to improve recruitment? I said, well, he said, well, I don't know anything about it. I would go talk to my project manager. And so I think the project managers are really those who hold the keys. Obviously, this needs to work with the community members in the CIRC as well. That's an important piece. The informatics, we mentioned, the EMR at Penn State. We do have I2B2 and Shrine and a few other tools to be able to identify cohorts of individuals. And then I think the idea of our affiliates from the Cancer Institute, we have about a half a dozen cancer hospital affiliates that they need to be engaged as well. And I would also put on there sort of institutions and think about, to put out to CTSI and others, are there really partner organizations, partner institutions that we ought to be partnering with to increase our recruitment potential. One of the things I think we can do is identify models and approaches. I think consistently we've heard that this needs to be tailored to the local community. And so providing, facilitating investigators getting descriptions of their target population, helping to identify best practices, experiences here, study finder, and we've also begun some discussions about a volunteer registry as well. Then after we know what they are, transfer those transfer those out to the investigators, project managers, and people at Penn State. And I guess one of the things I want to acknowledge here is that I realize that most of my experience and from what Penny has been talking about have been involved more in community and some prevention studies. And I think that we really need to be able to figure out how to transfer some of that experience over to the clinical area as well. I realize those are two different entities, but I think that we can both learn from that same process. And I just want to acknowledge that up front, that is a reality. Disseminating those resources. So I think we already have some resources. A few years ago, we had a recruitment workshop in the Cancer Institute where we came up with a evidence-based list of recommendations to recruit underserved populations into studies. We lump those into issues that the institution ought to do, that it is really part of the institution's responsibility to make that happen. So if, for example, just being able to monitor recruitment and efforts and people who refuse, I mean, that's all part of something that I think the institution can help us with. We also see significant issues around sort of the protocol and budget. There have been a number of times when I've been asked to help recruit individuals after the study has started. There's no protocol for doing anything in the community. There's no budget for getting those people involved, and you kind of are expected to pull a rabbit out of the hat. And then the third set of area was related to community and community engagement. The idea of identifying local studies, champions, specifically targeting communities. And then fostering research. As I said, Betsy had put in an R21 application earlier. I think it's time to kind of revise things like that. What we were proposing there was to actually test 2 different strategies to recruit to an ongoing chemo prevention study. And so, I think there's a need certainly to approach this from a scientific perspective. And then just as I was, thinking, you've only heard a few things, but this is from us today, but there's a whole lot of expertise out there and experience in doing this. And so I thought I'd start a list here, and I know that whenever I start a list, it's going to be extremely short-sighted. There's a lot more that's going on. Josh and Jonathan have a lot of experience in tobacco use and T-Cores. Cher Mama is starting Harmony and Health here at Penn State, as well as we're working with her in a rural community for her study. Chris Yamana has his Band Together program, working with churches in central Pennsylvania. Katie Schmitz is starting a cancer survivors study cohort in central Pennsylvania as well. Bill Curry in our family and community medicine has done work with sort of system transformation in rural primary care practices. Janice Penrod has her nurses engaged for community engaged research as well. And then just a couple of things that I've been involved with here. As Betsy already talked about, we looked at the Betsy 90 adults from both rural and urban sites into her recruitment methods. We had 157 adult residents from Appalachia into a multi-level faith-based strategy, so we can get out in the community and be able to recruit individuals like that. And then Auralia Dominic, she finished up her KO, or is finishing up her KO1, and was able to recruit Hispanics and Latinos into a randomized study as well. So Central Pennsylvania, just a couple of slides to close us out here. Yes, while the majority of our population is white, there are majority minority communities. Reading, Harrisburg, for example. Lancaster is close to that. 52 of the 67 counties in Pennsylvania are Appalachian, which is an underserved population, at least from the NCI's perspective. And then the Hispanic Latino population is an important group to think about in Central Pennsylvania. We just released a document showing the cancer burden among Hispanics and Latinos in Pennsylvania. And then I'd like to show this map here that Holly Barkus published a while back, sort of combining the Hispanic Appalachian area. What it shows is that the fastest growth areas for the Hispanic population in Appalachia is in Pennsylvania. And from some of the work we've done, these are very different populations and important to study. So while it represents, 7 or 8% of our population, it is a significantly growing population. And then from the Cancer Institute, so we are compelled to define a catchment area for the Cancer Institute. And this lists how this has been defined, but basically it's 27 counties, about a 3-hour driving time from Hershey to the perimeter, 4 million people. And like I said, about 85% non-Hispanic white and 7% Hispanic, and 18 of those 27 counties are Appalachian. So from the Cancer Institute perspective, we have to maintain sort of a population perspective in what we do. And I believe that is all that we have. So anyway, actually I made notes while Penny was talking. A couple of things I did want to mention as well that I skipped over here. So with this Walk by Faith study, actually what we did was ask individuals if they'd be willing to donate biospecimens. 75% of the people in the study said they would be willing to do that. We think that partly came about from a faith-based approach, a community-based approach. So I get that's important. Also through that project, one of the graduates of Penn State, Janice Raup Krieger, has developed videos to help individuals recruit, taking a family-based approach to recruitment to trials of patients for cancer. So we need to look at processes like that as well. I think that's it. So actually now I will get to the thank you slide and open this up for questions and more discussion. How are we doing on time? We have about 10 minutes. Good, thank you. So questions, should we start here at University Park? Janice.
Do you envision the RIC providing consultation during proposal phase of the grant to design a recruitment plan?
The Penn State HUB, yeah, I think that I think that at least some sort of limited recruitment input should be part of what we are able to do.
I think it's needed.
I hate to give away Betsy's and Penny's time, but at least we're trying to identify some people who have experience in that area.
The other opportunity is through the national RIC with a specific question related to recruitment. Which one's the RIC?
Vanderbilt.
Vanderbilt will take a look at a protocol and give suggestions based on that with the application. There are 2 levels of requests, and that's a level 1. That's a specific question, either based on a pink sheet summary statement back or before you submit if you have a specific question.
And the size of the grant is not important.
As long as it's multi-center.
Multi-center. Right. Okay. Thank you.
I have a question for Betsy. If I sat in a room for an hour and people told me all about exercise and eating well, I would say I'm going to lose weight, and I think my pre and post survey would change. Have you followed that out, or can you envision how you would follow that out to tell if you actually get these people who say they would do participate in clinical research to participate?
Yeah, that's a very good question. I think that even though we got very positive, change as a result of the educational program, the next step in this process is actually, pursue the R21, as Gene mentioned, and look at the outcomes in regards to actual trial uptake among these folks. So I think the next step is to take that to that level and do some measurement and outcomes of the educational process.
Yeah, and Neil, there are a number of studies that have asked how the person who enrolled learned about the study. So that in fact, some of those tools are out there for assessing that.
It seems to me that the chemo prevention type of study would be the target, because then you really want to get out to the community and not wait for them to develop the disease.
Right. Yeah. Right. Yeah, I think that when that went in, that was the goal. We were proposing a randomized process, I think a community-based randomized process to look at individual recruitment differences, enrollment differences. Oh, and I guess the other thing I should mention is that I violated my own rule here, which is we always have to talk about recruitment and retention together. But when I kept trying to think about what's the short part of R&R, I kept thinking rest and relaxation. That's all we want to do. And then railroad came up my mind. I couldn't figure out that. So anyway, the retention piece is critically important as well, not just the initial enrollment, because obviously the goal is to finish your study with everybody with the power that you needed, not just to get them started.
Yeah, and along those lines, what's really important is, to really pay attention to who you're recruiting. And, I think good clinical trialists can tell if somebody's really committed. And so, and the last thing you want to do, as you're just desperately trying to meet your recruitment targets, is to beg somebody to be in your study. Oh, please, 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 we really need you, because, you're only going to get a dropout there. So the two go together hand in hand. And, good recruitment is so important for retention too.
Mm-hmm. So with the volunteer registry, so I think one of the things that we need to think about, for example, is yes, we can do strategies to get people enrolled, but we need to make sure that they stay engaged, that it's not just a one-time event for them, but that they really remain. And I think that is something that our Office of Marketing and Communications can help with.
Yeah, following up on marketing and communications, the information that Matt presented, unfortunately, he's a Penn State Health employee. And so the work that he can do is limited to basically the Hershey campus or collaborations with the Hershey campus. I've had some discussions up here with the biobehavioral health group about a group of researchers going to Neil Sharkey and someone in strategic relations, or I'm not sure what the office is called, and get a counterpart up here, because to have someone to go to for your posters, for your recruitment, for your social media, who knows the space and knows what they're doing is invaluable. And we tried to offer Matt services, but weren't allowed to. But a counterpart that could use him as someone to learn from, I think, would be very helpful. And I would imagine that would be seen as valuable.
Questions from the Hershey folks?
We have a question coming in from our folks online. They were asking specifically for the University Park campus if there's a contact for the research outlook or outreach organization to work on getting a table in the hub.
I think you can actually just contact the hub central desk and ask for the opportunity to be in the hub. I don't think for those tables and that there's any cost, but I could be wrong about that.
Yeah, we didn't pay anything.
I don't think there is. you know, there's probably a limit to how many tables a day or something
Yeah.
that are in the hub. They don't want the whole place full. So I think you just have to contact the central information at the hub. I don't have a specific person.
Any other questions, Sarah? Betsy?
I have a question. It's not a question. It's put Janice on the spot. You know, Penn State has these campuses all over the state. I know that people who came to this meeting may not have been to Janice's, where she talked about the Research Nurses Network. 14 campuses. The College of Nursing is at 14. We have representatives at 9 campuses across the state who are at least master's prepared nurses. Some of them hold doctorates and are prepared to help you gain entree into the community. So if your project involves other sites across the state, if you'd like to be in contact with me, with the College of Nursing, Penrod, P-E-N-R-O-D, be in touch. And if we have a research nurse in that community, she can help you identify community partners or leaders in your area of interest and make introductions for you.
And other campuses too, I know in the social science side, we have a project in York, a multifaceted project that's sort of located at the York campus. I think that's probably in the catchment area.
Yes, it is.
And, you know, they've been running for years and know the players. I mean, they're going through schools, they're doing behavioral kinds of approaches, but the campus faculty, you know, like the nurses, if we could do better with the campus faculty and engage them as collaborators in our projects. And there's not a College of Medicine, there's not even nursing college faculty at every place, but there are other kinds of faculty, and this may be a direction that we want to take. I know in the broader Penn State strategic plan, there's increasing eagerness for we are Penn State, and to really have these connections around the state for research and teaching.
Mm-hmm.
Okay. Janice's nurse network is really the model. I think we need to really push at that.
Mm-hmm.
Okay, I think we are finished. I don't see any hands or any questions going up. Thank you, everybody, and Betsy, Matt, and Penny, thank you.
Thank you.
Yeah, thank you.
Was it? Yeah.
Got a lot of time.
Looked like we practiced this, huh?
Yeah, you guys are right on it. Yeah.
Let me get out of here so you can do your work. Sorry. Good to see you guys. Good to see you too. Thank you for